Good results in facelifting are something I talk about a lot because it's a very difficult thing to convey. Every person deservedly wants the best result of their facelift that they can have. People vary so much. You can't have somebody else's result. You can only have the best result you can have, and people bring different potentials to the table in terms of skin quality, bone shape, soft tissue density and support, natural shapes, for example, somebody who's got a full neck versus a skinny neck that they were born with. So designing the operation really relates to examining the patient physically and understanding as the surgeon their physical potential for a facelift result, then the rest of the understanding required in terms of determining how good a candidate the person is their psychologic approach to themselves, their reasonableness in what their requests are, and their ability to take on a level of result that we can agree on rather than maybe the aspirational result that they have in their mind. Facelifts are very rarely perfect, but reliably produce a significant improvement in appearance and solve the problem. But if someone is going to really be very didactic or very rigid about the kind of result they are expecting, they may well not be a good candidate. They may be setting themselves up for disappointment. So in all of that, in the physical examination and the discussion with the patient about their needs, and then trying to get to know the patient and understanding where they're coming from psychologically, it's a tremendous amount of information to consider and should be done over time. I would never really think that someone could have a half-hour discussion about a facelift and then plan the operation. There's way too much to know. And so you find out over time in developing your pre-treatment relationship with the patient as to whether you think this is a person who would see, in the end of the day, the facelift as being a positive experience, or somebody who may end up with a poor result in their eyes, which may or may not be a poor result at all. And those, if someone's in that position, then they're probably not ready. So it's a communication exercise as well as me being able to communicate clearly what I think the person's potential is. And we do this using pictures and other patients and various discussion points to make the surgical plan. Developing the surgical plan for a well-adjusted person is the path to a nice result and a happy patient.